Alright guys, today I'm going to show you how I would use a Gua Sha bar or instrument assisted soft tissue mobilization tool like such on your hamstrings. I've had a lot of requests from clients that I see. How do I use one of these on hamstrings for whether it's tightness, muscle recovery, they're sore, they just don't feel right, you had a big long workout, you went on a hike, you name it. So I'm going to show you how I would use one of these bars on my own hamstrings. Here we go. Okay, so the things that I got here are my bar, multiple different brands that you can get, a little bit of coconut oil, easy, cheap, sanitary. I'm gonna take the coconut oil, rub it on the back, acts as a lubricant. Then I'm simply gonna take well first, here's a little bit of anatomy. So hamstring, bulk of it is right back here. And then you have your biceps femoris coming through here. And then the bulk of what you guys see at this angle is going to be my vastus lateralis. Whenever I'm working the hamstrings, I will get part of this vastus lateralis, part of that IT band, that's part of it. But on the inside, the medial portion that's more towards the groin, that's your semimembranosus and semitendinosus. But on the outside here, that you guys can see, is the biceps femoris and part of the vastus lateralis that goes with the quads. So I'm going to take the tool, I'm going to start off with the top of the smiley face, and I'm just going to work it back and forth. Anytime I do this, I start off nice and light. I'm just trying to warm up the tissues. Also, I'm taking note, is there anywhere that's particularly uncomfortable? And right now, all I feel is just a bunch of gristly. So I haven't really hit a depth that's too horribly tender. And I may not have anything because I don't feel any tightness or issues with my hamstrings right now. This is just for demonstration purposes. But you can tell I'm working at different angles, trying to hit different areas of the muscle groups as I go along. So if I was having some pain, for example, say I was having some pain near that the biceps femoris part right through here. Well, I would just hang out in that area and concentrate my efforts in that area. I would work that area until a good bit of that discomfort had dissipated. And then once a lot of that discomfort had dissipated, I would move on. I would look for other areas. As the muscle and everything warms up, I can apply more of a pressure. So instead of going nice and light, I can increase my pressure and hit those deeper areas. Now when I start to go deeper on myself here, I can feel that there's a spot back in here closer to the inside portion of probably the semimembranosus. Not for sure, it's kind of hard to palpate yourself sometimes. But either way, I would work that area for a little bit, and I'm gonna work it until a good bit of that discomfort has dissipated. Now this is just one angle. It's not the best angle for you guys to see, so I will try some different angles here shortly. But as I'm working that deeper pressure, I can tell that some of it has started to dissipate. The other thing that you can take note of as well is depending on which direction I'm going, whether if I'm going from closer to my hip down or closer to my knee up, I'm paying attention to, is one direction more uncomfortable than the other? Because what I like to do is say going from my knee up to my hip is more uncomfortable than going from hip down. I will start with the one that is less uncomfortable, that has less discomfort to it. I'll let that dissipate and warm up, and then I'll go the other direction, the more uncomfortable direction. Now, if I had a real common spot, especially on IT band syndrome, is kind of that junction where the vastus lateralis and the biceps femoris meets. So that's a good area to check as well. And again, I'm going to go off light, look for areas, and then once I find an area, I actually have a little area right there. It's actually on a thicker part of that IT band. I'm going to concentrate my efforts right there. Work that area until a good bit of the discomfort has dissipated, and then I'm going to move on. This is a really common area that folks will see, and I'll see petechiae. That's the fancy name for a hickey. Not the end of the world. It's not bathing suit season. Plus you'll heal up. Anybody who's ever had cupping done with the suction cups through a massage therapist, PT, chiropractor, you name it, that's the same thing. That's petechiae, fancy name for a hickey. They heal up and go away, but that is the process that I would do from the hamstrings. Now I'm going to show you a different angle. So here's another view for you guys. The camera is on the floor looking up onto my hamstrings. So this is the back of my leg. On the inside here, I have the semimembranosus and semitendinosus right here on the inside. And then right here is the biceps femoris. On the very inside of my thigh, this is my groin, my adductor muscles. And then this outside chunk right here, that's going to be my vastus lateralis, which is part of the quads. So again, I'm going to start off with the top of the smiley face, scanning the hamstrings and essentially part of the groin, part of the outside of the quads. I'm going to start off lightly, looking for any areas that are tender, uncomfortable, anything that jumps out at me. And once I find it, say I found it right here where you can see my fingers snap over the tendons of the medial hamstrings. Say that's tender. I'm going to hang out there. I'm going to focus the tool right through there. And I'm going to hang out there until a decent bit of that discomfort has dissipated. If this spot is exquisitely tender, what I'm going to do is I'm going to figure out which direction is the most uncomfortable. And so, for example, if going from my knee to my groin or knee to my hip back towards my body is more uncomfortable, I'm going to start with the opposite direction. I'm going to let a good bit of that discomfort dissipate, and then once it dissipates, then I'm going to go the more uncomfortable direction. Once that process is done, and I've checked out the hamstrings in the back of the thigh at that tissue depth, I'm then going to go from a light pressure to a heavier pressure. And then I'm going to recheck everything. And then say this area is now feeling pretty good, but at that deeper pressure, I feel a knot or a discomfort right here. I'm going to do the same thing. I'm going to use that deeper pressure, and I'm going to hang out in that area, and I'm going to work it until a good bit of that discomfort has dissipated. And again, in that area, if it's too uncomfortable to go in a particular direction, I'm going to find the direction that is the least uncomfortable. And I'm going to start with that, let it do its thing, and then I'm going to switch back to the more uncomfortable direction. The whole process of this is to increase blood flow into tissues. The same idea as why somebody warms up before an event. You warm up before you exercise. It's all about blood flow. Blood flow to the tissues gives them the nutrients and oxygen that it needs to perform properly. And then before I'm done, I will check out everything again to make sure I got it all, or at least most of it. It's hard to get it all. And there is my demonstration of how I would use a Gua Sha bar, also known as instrument-assisted soft tissue mobilization, on my hamstrings. Hope this helps.